You're just kind of strained everywhere, aren't you? We can. Don't worry.
Not feeling great.
We can handle that. This is always tricky to do with tall people. I wouldn't know what that's like.
And
Yeah. Very, very good.
well done.
Yeah. There. Do you see that bulge? All right. Once again, right there. Eric, good to meet you today.
Thank you, too.
All right, Eric is in today on the recommendation of his sister. He's got some acute neck pains that onset. I think you said sometime last week.
Yeah, Saturday.
Do you mind telling us a little bit about what's going on, when that started, what's happening right now?
Yeah, it happened on a fly machine.
Okay.
So I was working out, and it was the first rep of a fly.
Oh no.
Yeah, and it's happened actually the previous 2 or 3 times right when I start working out again after maybe taking a break for a month or two. I feel like I've noticed a pattern. It's actually when I'm working out chest, funny enough.
Okay.
Maybe I've just lifted something.
Now what is it? Where is it exactly?
I'm not sure. It feels like maybe there's something going on a little bit lower center left.
Okay.
But basically the symptoms I'm experiencing is pain, and in sort of little spots too. Like there's little spots along my arm here. It was actually bad here at one point.
Okay.
I felt a little bit down my arm.
Are you getting any numbness and tingling into any of the fingers at all, or not really?
There was just a few times where I was using like a massage gun to loosen it up a little bit, and if I was digging in, I felt some down into the thumb. But the main thing that's happening is, by the end of the day especially, all the muscles here going up to my head are throbbing.
They're just seizing up and feeling really okay.
Yeah, and I've been sort of massaging it and kind of trying to do some exercises. But yeah, so basically it's loosened up a little bit. It was actually better a few days ago, and then it seems like today and yesterday it's kind of...
Did you do something, to the best of your knowledge, that might have flared it up as it was recovering? Or maybe you just woke up and it felt a little worse, maybe you just slept oddly on it already? Or
Yeah, I've been trying to sleep just straight on my back. That's actually when this has happened before too, similar injury, and this time the first few days sleeping, if I am laying down... I basically have to be very careful with sleeping, and when I go to turn it's immense pain.
And where do you feel that immense pain exactly, if you can?
Center of my spine and like my upper mid back through to my neck.
I'm just going to take a peek right there. So you're saying like kind of about here.
A little lower,
kind of about here.
Even maybe lower, a little bit. Somewhere in that area, it feels like it's starting.
All right. So it's pretty dispersed back there, and it's hard to pinpoint an exact location, but we'll definitely turn you around and do a little bit more poking to try to find exactly what structure that's coming from. Are you able to turn your head to the left and right for us here? How far you can get? So you can get to about, I'd say that's about a 40 degrees to the left. Now what about to the right?
Starting to tighten up there.
Yeah. Okay, less significantly to the right. That's more of a 30 degrees. So we're decreased on both sides. We're going to compare that again from a better angle so I can get a better measurement. That was just an estimate. But okay, so you're getting occasional pain into kind of the shoulder area too. You were pointing at the lat.
I was actually feeling it a little in here.
Okay.
Yeah. And there's some little spots that will show up, like a little bit of tingling. Kind of throughout this zone, and then basically by especially the end of the day, if I'm standing up and the back of the neck is
very, very tense up,
very sore. So then I have to basically lay down too.
And this happens when you're doing. This has happened 3 times when you were doing chest flies.
Yeah, or it might have been free weights too, like or bench press or something. But it seems like it's happened during chest work.
Okay, so chest-related workouts seem to be the thing that onset this. How long have you been working out for?
A little bit on and off my whole life, probably.
Okay, so most of your life, and I think you're 30, early 30s,
yeah,
34. I don't. Some people don't want to say their age online. I fully get that. But okay, so about 34 years old, on and off. Lately, have you been getting back into it recently, and then this kind of flared up, or have you been going?
Just taking a break for a month-ish.
Okay.
Was kind of doing more running and stuff like that, and then got back into weight training, and it was maybe the second day getting back in that it happened. So
or you're all ready to start like a good thing, and then this just I've been there, man. So I've a lot of patience. Okay, so everything you're saying sounds right now pretty simple. I'm not too worried. Yes, you got a little bit of the tingling in the hand, but that comes and goes. It's not consistent. What we're gonna do is we're gonna do a full physical exam. Okay, we're gonna figure out what the most likely diagnosis or cause is for everything that's going on here, and A, get you on the path to getting better, and then B, trying to figure out how to prevent this from happening again. Okay?
Yeah.
Sound good? Do you have any questions about that at all?
No, just I guess the only area of concern was just that just in past experiences, having seen a chiropractor and then later sort of finding out that it was actually like a disc issue. I guess I was just wondering how you approach treatment if if I'm a little bit worried that it's something like that potentially, or I know that's something you probably can't diagnose.
No, I can absolutely diagnose discs,
Okay.
and I've seen many discs, and I've gotten many discs better. The thing about discs is that they take more time as compared to like a simple joint-related issue. Okay? If you've I'm going to use the word tweaked, a joint capsule, you're going to respond really well to things we do in here. But if it's a disc issue, if you actually have a bulging of the squishy stuff between our vertebrae, that takes more time for it to resorb back into its normal location. There is a specific program that can be done to help encourage this happen and decrease recovery times. Mackenzie extension in the neck, and we can absolutely walk through that too. That being said, discs aren't the most common injury. I know that it happened to you once, so now you're predisposed mentally to think, oh God, it's another disc, I don't want it to happen. And I get that, right? Like anytime somebody's had a history of X, X is obviously a bad experience. They're pretty fearful of X happening again. Okay, you see it in patients of any different kind of, any different field. All right. So first off, if I think it's a disc, I'm going to tell you. Okay. And if I think it's a disc, we're going to treat you according to it being a disc. Okay. Does that make you feeling better?
Yeah, for sure.
Awesome. Any other questions that you want to ask before we start?
I think that's okay.
Awesome. Then let's get into it. Okay. So we already did a preliminary neck range of motion exam, but let's go ahead and do that from an angle where I can definitely see things better. So first things first, I want you to bring your chin down to your chest for me. And does that provoke any kind of pain down the back of the neck? Does it provoke anything to the arm at all? Numbness, tingling?
Down is not too bad. No.
Awesome. Now if I go ahead and do something kind of mean and actually push it a little bit further, better, worse, or the same?
It's actually not bad.
Not bad?
A little bit worse when you got down to the bottom.
Okay, now look up for me. Look up towards the ceiling if you can. So, we're moving. Are we hesitant, or are we getting discomfort and some pain?
A little tightness in the middle of my back,
Middle
but
of the back.
not pain yet.
All right, if I again
think
do something...
left and right would be...
Do something kind of mean. Better, worse, or the same?
Just more tight.
Just more tight, okay. I want you to tilt your left ear to your left shoulder for me, okay?
Okay. I'm just going to start slow.
Dude, take as much time as you need to, okay? So you start, what do you get?
Tightness on the left side of my spine.
Okay, down here.
Just some general discomfort, but it's not sharp pain yet.
Nothing into the arm?
No.
Perfect. And let's go the other way. That seems like it's okay.
Similar, not pain, just sort of a pinching in the middle of my spine.
Middle of the spine. You saying like right hereabouts? Okay.
Yeah, not pain, but just a little bit of pinching.
Okay, look forward. I want you to rotate again as far as you can to the left.
Looking left?
Yep. Okay, so we're at about 45 degrees to the left there. That's as far as we can go. Oh, look at that. We can go further. We're at 50 now. And if I actually try a little more... That's okay, you get some pinching there. Okay. So anything past 45, we're kind of getting that pinching sensation down here. Rotate as far as you can to the right now, please.
Feels tighter, yeah.
And that's we can get to about 30 degrees on that right side. Okay. So we're definitely very cautious with our movements. We're definitely very tight. I can feel through his traps right now, and they feel like they're quite engaged. Now, it is kind of hard to pinpoint an exact spot on you. So that there isn't primarily where you're feeling the discomforts, then? Or would you say that's
I actually thought where I'm feeling some there, but where you first placed your thumb actually...
Kind of right down here.
Yeah.
Okay, that spot there. All right. Now, how about this spot versus this spot?
I think where you first
spot. Okay.
It's a little more so.
All right, good. So what I did there is, and obviously you guys can't see this because the camera's there, but I had my thumb about 1 inch to the left of where his spine is, and then I had my thumb right on his spine proper. So you keep on saying that you're feeling your pain right dead center on your spine. It's actually not true. You're actually off to the left by about 1 inch.
I think it is off.
And that's good. All right, that's a good thing. Why? Because if we have pain directly on our spine, that's one of two things. Okay, either you broke and fractured your spine one way, which I didn't think you did based off the history, or maybe it's a disc issue.
Yeah.
Okay. Now, when we go off to the left, especially when we're in our upper back here, incredibly uncommon that we actually have a disc injury there, because the thoracic spine, the upper back, it's very, very well secured and held together by the rib cage. Okay. Now I know that you had a herniated disc in the lower back. We get herniated discs in the lower back. I'm going to use the term all the time. Not actually all the time, but that's very common because we don't have a rib cage to hold everything steady there. We have a core, and the core can sometimes be insufficient.
Yeah.
But up here to the left, what we do have are our ribs. Okay, our ribs inserting in the spine. So do me a favor, give yourself a tight hug for me. Okay. Now rotate as far as you can to the left. Does that cause anything down here?
No.
No? Good. No. Okay, I'm going to go further. Still okay?
It's okay.
Good. Now rotate as far as you can to the right. Anything there? No?
It's okay.
That's okay. Good. All right. Now, one other thing I want you to do here is I want you to bring your chin down to your chest once again. Slouch for me. And I want you to bring, let's go with your left leg up for me. Straighten the knee. Does that cause any zinging at all?
No.
No? Now do the other one. Okay, you guys can't, there we go. That's actually a really good angle. You can get that one. And no zigging with that either.
No.
Perfect. So that's something called slumps test. That's -2 to check for a disc injury. So right now I'm really not sold on it being a disc. It's possible that it is, but I'm leaning away from that direction currently. Okay. So I hope that kind of gives you a little bit of reassurance there. All right.
Yes.
All right. Go ahead and bring your arms up for me. Keep them there. Don't let me move them. Okay. Fight, fight, fight. Good. Fight, fight, fight. Good. Those are both nice and strong. I'll get you to bring your arms forward and curl the wrists backward for me. Nice. Good, good. Good, good. Turn over, curl the wrists inward. Strong, strong. Don't let me move it. Good. Good. Fingers curled. Keep them curled. Nice. Turn over, fingers straight, and please gently squeeze mine. Good. All right. So those are all nice and strong. In the event of a disc herniation or a disc bulge, what happens if we get pressure on any one of those associated nerves, one of those movements would have been quite weak, where my resistance against it would have caused him to just completely break form. Happened a couple times, but when I told him to shore up, no, he was strong. The strength is there. So again, now let's do the reflexes. I want you to relax the arm right there as best you can. As best you can. Good. So we get a flinch there, we get a flinch there. Drop the arm into my hand. Give me the full weight of your arm in your hand. Good. Got a flinch there. So the flinching is normal. That's what we want to see. So go ahead. Give me the full weight. Full weight. Good. Good. And relax. Turn over for me. Good. Relax there. Good. So totally normal, both sides with the neuro. Again, we're leaning away from a disc injury. Now, also, real quick, Eric, you mentioned that you were playing hockey earlier this week and you were getting some lower back discomforts with that too.
Yeah.
Can you share about that a little bit? Because we want to treat that today too if it's something you're dealing with.
Yeah, I think just in these areas, right and left of my spine, kind of in here is where I feel a lot of lower back pain.
Mm-hmm.
And I think just the twisting motion of hockey,
Yeah.
I think compromised that. And then I think the upper back injury happened the next day, so I was wondering if they were connected at all. But
honestly, they could be. If you got one area of the back that doesn't want to move, what's going to happen if you put necessary strain on it, and especially if you load that movement, you're going to get other areas of your spine, other areas of your body compensating, okay? Like a lot of people who have lower back issues will begin to develop upper or pelvic related issues, because those are the areas right next door to it, and those are the areas that now need to absorb an excess shearing load.
Yeah.
I'm not saying that this was definitively caused by that, but it could have been playing a factor, right?
Yeah.
As well, you mentioned that a lot of the tension is up here, actually even feeling through the neck. I haven't actually felt through the neck yet. I usually wait till later to do that. Like, that feels pretty ropey to me, and that's where you're feeling the discomfort kind of radiate up into the back of the head too.
Tingling and then throbbing, especially near the end of the day. All of this is very sore.
Okay, yeah, all right. So again, if we've got kind of spread generic back pain that comes up into the neck, out into the shoulders, down into the spine there, and we're negative on all of our neuro tests. Remember, negative is a good thing in medical lingo. You don't want to be positive on stuff. That typically means you have something going on, unless you're trying to figure out what's going on. Again, I'm leaning away from disc. We're looking more at just a particularly bad muscle spasm, especially given the lower back muscular strain. Now that I'm poking down here, this feels for a bit. You're just kind of strained everywhere, aren't you? We can, don't worry.
It's not feeling great.
We can handle that. We'll handle it. We'll get you better, okay? Again, anytime we're treating a area of the body, if it's upper back, we do an upper limb neuro. If it's lower back, we do a lower limb neuro. We're going to be doing the lower back in the treatments here, so we're going to include this. I'll get you to go ahead and push the leg up into my hand as hard as you can. Good. Leg up into my hand as hard as you can. Good. Toes up as hard as you can. Toes up as hard as you can. Good. Relax for me as best you can. Okay, so slide back a little further so your feet are off the floor. Good, good. This is always tricky to do with tall people. I wouldn't know what that's like. Okay, good. Good. And one more. Relax that foot. Good. Good. Harder to visualize the impulses down here. That's why I always grip to feel him kick back into my hand. Again, that's a normal lower limb neuro. So let's actually feel through Eric's back here, all right? So we'll start down low in the lower back because he is having that history of lower back tightness and complaints. Although right now we are definitely most concerned with up here, this left-sided region. So again, let's start low. Going to start with the SI joints, okay? Bottom of our spine exists our sacrum. Our sacrum connects to our iliums, which is our hip bone. So we're going to connect, they connect right here at the SI joint there. Do you get any pains as I press in through either of those?
Okay.
Awesome. All right, now let's go ahead and climb up the spine. So working into the lumbar erectors, or the muscles that help us to stand erect or upright. These guys are quite engaged currently. Now, usually we don't want to see that much engagement if we are laying down. Tells me these are still probably pretty worked from when you were playing hockey, okay? Okay, now definitely as we get higher up, do you feel the difference in muscle tone as we get higher?
It's just starting to hurt.
Yeah.
It's like, yeah, as you get higher.
Exactly. So
Really painful in that area.
this is typically where I see most rib complaints, okay, occur. So ribs can hurt quite. Oh, did you feel that?
Yeah.
How did that feel, by the way?
Felt good.
Felt good, right? Okay, so I don't think the mic picked that up because I was talking, but that one of his ribs actually just adjusted with the smallest amount of pressure through. That was maybe like a 4 out of 10 on the pressure, and it felt good. Okay, so that's a good sign that this is something simple and not to be overly concerned about. So I'm going to shut up now while I continue to climb up his spine, and hopefully the mic will be able to pick something up. Good breathing. Okay. You okay?
Yep.
Good stuff. Okay. So I'm going to adjust the left side here. For this, I'm going to get you to take a big breath in. And all the way out, all the way out. Good. In. And all the way out, all the way out. Good. So we had 2 little pops right there. And another one. You're very interesting because you go almost segmentally. You go like one at a time. You know, a lot of people be like, no, one at a time, and I like it. It's nice. Breathe, okay. Now I'm going to try to stretch out the upper back a little bit. That was my elbow. If at any point in time anything I'm doing is too painful, you can either tell me to just go a little lighter, or you can tell me to stop and my hands will come right off, okay?
Yeah.
So I think we got most of what's up here one at a time. But take a breath in for me. All the way out, all the way out. In. All the way out, all the way out. There's a little one right there. Good. Okay. In. All the way out. I'm going to turn your head. Relax for me. Okay, I don't think there's one there. All right. How do you feel?
Pretty good. A little
Good?
sore, but
Oh yeah, good, good. So what we're gonna do next is we're gonna get you on your back, okay? Eric, I want you to just try to relax your head as much as you can to my hands, okay? Now I know and I understand that you're probably nervous about having your neck adjusted with how much discomfort you're in. So we're gonna take our time with this, okay? We're gonna start just by doing some soft tissue work in through the area. Just trying to calm down some of the extremely tense muscles we got, okay?
yeah.
Of course. No, thank you. Thanks for coming in today. Appreciate you.
I appreciate it.
Drop, give me the full weight of your head. So I'm going to pin, and I'm slowly going to rotate you. Just to try to induce some movement through there.
Ooh, that's the spot.
Yeah. I'm usually pretty good at finding the spot. Drop. Now, would you say there's more discomfort present in your neck or your upper back when you came in today?
Actually, when I came in today, it was more of my upper back and shoulders where I was getting some tingling.
Yeah.
But towards the end of the day and last night, it was all the muscles leading up to my skull and behind my neck.
Got it.
There. But it always sort of feels like it was originating from lower.
So let's do another test here, okay? I'm going to take this arm. You guys can't really see this, it's off camera, but I'm going to bring your arm up, extend your back like that. I'm going to rotate your head like this. Do you get any kind of numbness and tingling to the shoulder or hand with this?
Not right now.
No, not right now? Okay. Now what if I go ahead, turn your arm over, and do this here? How about now?
No.
No? Awesome. Give me an okay sign, like this, with this hand,
Okay.
with this hand. Bends the elbow. Put this against there. Any numbness and tingling?
No, it's tight.
Tight
all
there.
along here and outside
Along the
arm
lat
here,
distribution there, but we're not, okay.
but
So
this arm tighter than this.
Of course.
Yeah.
So those tests right there, you can put your arm back down, or something called the upper limb tension tests, or the ULTT. Once again, when we herniate a disc in our neck, okay, we do get pressure on a nearby nerve. What happens then is we can do certain movements that can further aggravate that, which then tell us that a disc is going on. The upper limb tension tests are what we use to determine that for discs in the neck. You're negative for all of those. You're not getting the numbness, the tingling, you're not getting any shooting, not getting any pain. So again, I assure you, I don't think that this is anything major, okay? I think that's the third time I've done that,
Yeah.
but I can do it 3 more times if you'd like. Anything to
No,
just
I
make you
appreciate
feel
it.
better about today, okay?
Yeah.
Okay, so let's get this left side. So to do this, you've had your neck done before, you think? You can't really remember?
So.
And then relax into my hands just like that, okay? That's the first thing that I need. Now, the second thing that I need is for you to not know that I'm about to do it. So, how was that?
Good.
Now, did that hurt at all?
No.
Maybe a little scary, but it didn't hurt, right?
Yeah.
So, good. Let's go ahead and bring the mic over here. That was a really good release of just about everything in there. Same concept, you're nice and turned, and you just relax as best you can in that hand. Good job. Yeah, if the patient interview is the hardest part for you, getting the neck adjusted is probably the scariest. So now you're done the hardest and the scariest,
Yeah.
so well done, Eric.
What's actually happening with that neck adjustment?
So there's 6 different theories about what is happening with neck adjusting, and we're not, to be totally frank with you, 100% sure which is which. More than which is taking primary effect. More than likely, it's a combination of them. For you right now, because you're in a lot of pain, what is probably happening is that we're Are you talking about the crack, the popping sound, or the effect? Oh, okay. The popping sound is just when we do get really stiff up in our joints, we do get the formation of little air bubbles within our joint capsules. All of our joints are encapsulated by little small ligaments called capsules, okay? And we have air that will form in them. Adjusting briefly gaps these and gives an opportunity for that air to escape. And that's the sound you're hearing, okay? That's the pop, all right?
Yeah.
And once we hear that sound, what we found is that we get restoration of movement to whatever segments we manage to release. Now, the sound isn't necessary for a therapeutic effect. And that's because the actual therapeutic effect is coming from stimulation of something called a mechanoreceptor. It's basically a nerve that responds to mechanical energy. Mechanical energy means we're moving through it, literally my impulse.
Yeah.
So it's the thrust that actually matters, not the popping sound, but it's always nice to hear it just because it like people think that it helps, and I guess to a degree it does because it means that it's been a successful adjustment.
Yeah.
But not all successful adjustments have that sound. Does that answer your question?
Yeah.
Perfect.
So it's air bubbles, really.
It's air bubbles.
Yeah.
It's a little bit more complicated than that, but that's the easiest way to
Yeah.
explain it in a way that'll make sense. Okay, good job. Let's do your lower back, and then we'll get into the massage stuff. You're actually very close. I'm going to pull this so you're off your shoulder. There you go. And then relax the head there. Good. I'm going to bring this there. You can hold right there for me. Bottom leg straight. Top one bent. Scooch the hips towards me over here. Scooch the hips towards. Good. Thank you. A little bit closer, actually. Good. Crushed it. And I'm going to take this and then relax the hip in this position. Relax as best you can. And to do I'm going to shut up because it's just going to go. Well done. Yeah. He's smiling. You guys can't see that, but he's got a big smile on his face right now. Take this, pull here. You're gonna go right there. Hand on elbow. Put your hand on your elbow. Good. And scooch the hips once again. Close to me. Close to me. Thank you. Good. And again, I'm going to shut up because you're just going to release. Relax right there. So one thing I want you to notice is you were able to support your head up in the air there. Did that cause much pain at all for you? No? Interesting, because that probably would have hurt you beforehand.
Yeah.
Okay, so that's a good sign right there, an unintentional objective measure. But let's go ahead and do this now. Yeah. Very, very good. Okay. Eric is pretty tense and strained all the way from the upper lumbars all the way up into the C-spine paraspinals. So we're basically going to do everything, all right? And with that, we're going to use our favorite tools that we use with, I'd say maybe like a good 70% of the patients that we see in here, just to better work the muscle as well as the fascial structures that are involved. You guys are super familiar with this at this point. Now, Eric, when I do work on people doing this, I usually like to ask them a question about themselves so that the audience can have a chance to connect with you as a real person. So what I'm going to ask you today is to tell us something about your job, your career, that you find rewarding, if you're comfortable sharing that.
Oh yeah, sure. Well, I'm a musician and a producer, recording engineer, songwriter.
That's a lot. That's a lot of things. So I don't know.
Yeah.
Like, I know what a few of those things are, but
I just make music in the studio, and sometimes I'll join artists for live shows and help put live shows together for artists, live tours and stuff like that. So, So I mean, so much is rewarding. Definitely seeing the audience enjoy a live show and something you've worked hard on is
all the effort kind of pays off.
Yeah, exactly. I mean, seeing fans connect to music, and more recently been working more in the studio, so just seeing songs get born from the human experience, and turning struggles or good things, bad things into art, into music is always pretty rewarding. So
I always love listening to musicians or artists talk about their, I'm going to use the word craft, because they're completely correct with what they say. Like, I know that I'm obviously, like, I went my whole life down STEM and the sciences, but I think I developed a real appreciation for the arts during the pandemic when COVID kind of hit and everybody's mental health was kind of taking a toll.
Yeah.
A lot of people turned to music. A lot of people turned to, like, art, and it was just, it was really eye-opening for me at that time. So what you're saying with feeling people or seeing people connect through music and live concerts and whatnot, like, that stuff matters. That stuff matters a lot.
Yeah.
So thank you for what you do, and I'm glad it does feel intrinsically rewarding for you.
Yeah, I think a lot of people strengthen their connection to it in COVID because we lost some of it.
Exactly, that's just it, right? And we didn't realize it until it got taken away, the role that it was playing in our lives. So
yeah, exactly.
All right, now with this, if at any point in time it's too uncomfortable, you let me know, I'll back off.
No, it feels great.
Awesome, glad you think so. There's always an array of different reactions. Some people swear by this, other people think it's painful, but most people that I get in here seem to like it. So. Let's move this. There we go. don't use this one very often, so I thought I'd just let the camera see which one we're using today. So. Look very not you, but like the people who are watching here, look very closely to his traps here. When I move my fingers forward, you're going to see it slide right under my fingers, right there. Do you see that bulge? All right, once again, right there. That's the best visualization we're going to get of a muscle knot on this camera, probably.
Is that a muscle knot?
That's all muscle right there, dude. Yeah. That is your levator scap muscle that originates from the top of your scapula, which is right here, and comes up into the neck region just like that. Okay, so probably the main culprit behind what's going on. Maybe you're getting some resulting stiffness and soreness of everything else clamping down around it, but that's my guess for what's actually affecting you. And again, I know I've said this about 10 times, but very, very unlikely is this a disc complaint.
Okay. That area where you were saying the knot is
right
a pretty painful area.
That's the most painful for you, eh? Okay, yeah. get started with you looking up and to the left for me, if possible. Good. So that actually seems like you're doing that relatively comfortably. Eh? Good.
Yeah.
Happy to see. I'm going to go ahead and put this right there, and now you're going to slowly look down and to the right as I pin that muscle. Okay, go ahead. Slowly down to the right. FYI, this usually hurts a bit. Okay, it's the after effects we're going for, not necessarily the during. Good. You feel that slide right under the elbow there?
Mm-hmm.
Good. Now come back up to the left. You can come right back. You can come right back. That's fine. And now slowly down to the right once again. Good. And we're just going to repeat that movement a few times, okay? Up to left. Down to right. Good. Up to left. Down to right. And up to left. Down to right. Good job. Okay, face forward for me. Please tilt your left ear to your left shoulder as far as you can before. And now I'm going to take contact. Now tilt your right ear to the right shoulder. Go ahead. Good. Left to left. Come back. Right to right. Go ahead. Good. Left to left. Right to right. And left to left. Right to right. Good job. One more. And right to right. Nice. Awesome. Okay, I'll get you to look up and to the right now for me, please. And do the same thing except on this side. Good. Now please tilt down and to the left. Good. Up to right. Down to left. Good. Up to right. Down to left. Up to right. Down to left. And up to right. Down to left. So you're pretty knotted on both sides, even though your left side's definitely your trouble side.
Super tender.
Let's keep going. Up to right. Down to left. Oh, high. Up to right. Down to left. I feel like we should have just done this the whole time, actually. Face forward. Tilt right ear to right shoulder. And left to left. Go ahead. Good. Right to right. Left to left. Good. Right to right. Left to left. And right to right. Left to left. Okay. Good job. That feels a little better, but there's definitely more work that needs to be done up here. That's, yeah, but we'll get there. We will absolutely get there. Let's get you back in the chair, okay? Eric, I can see that you're moving your head around quite a bit, playing with the newfound, right? So you guys can see from here, we have a lot more range of motion in both directions. He's up to 50 degrees on both sides, whereas before I think it was just like a cap of 45. How are we feeling right now after all of that? I did go pretty hard on you, actually.
Good, yeah. I feel great.
Happy to hear.
General, like, release of tension, I think. Yeah, a little just sore from it, but in a good way. I feel like I can look left to right more.
You're going to be able to drive home a lot more safely than driving here. The blind spots, you're going to be able to see them quite well.
Like this way, there's just a little bit of pinching still, but it's not what it was.
Yeah, you're getting a lot to the right. You could only get 30 degrees before. I remember because that was the side that I was more concerned about with his left side being affected. You're not going to be able to turn right as far. But now we're getting to 50. Okay, so that's a 20 degree increase pretty quick. And it also tells me if, for example, we were doing the range of motion testing now and there was no improvement and the pain was the exact same, again, my head would go to disc. Okay, I've said this and I'm really beating a dead horse here. Not a disc. Okay, 99% confidence. Overall, what happened? You had this levator scap. I talked to you about that, and again, let me show you on your app, on the app before you leave. That seems like it's where most of your discomfort's coming from. It also limits rotation to the opposite direction if it has a contracture. With a lot of chest-based movements, if somebody is rusty or if somebody is like fatiguing out, maybe I assume you did exercises before the chest flies, or was the chest flies like the first thing you did that
I
day?
didn't do enough before, actually.
Maybe you didn't warm up. But what a lot of people will mistakenly do on their chest days is they will begin to hike their shoulders up. Okay, so also with chest flies, if the seat, were you were doing a machine chest fly, right?
Yeah.
So if the seat is not positioned correctly, you're going to alter where you are, where your arms are, by hiking them up like this. Okay.
It was probably too high.
You were probably actually too low. Okay, because if you're too high, well then your arms are going to come lower down to grip them. But if you're too low, your arms are going to come higher up to get the hands.
Yeah.
Okay.
So you want to avoid being too high.
You want to avoid your arms being too high by having the seat be too low, if that makes sense. Sorry, we're talking about two different things there.
Yeah.
But if you do hike the shoulders up incorrectly and then load that movement, that is putting an incredible bias on your upper traps and your left scap.
Yeah.
Now your left scap, it's the smaller muscle of the two, so it's more likely to go, so to speak, than the upper traps there. But with the chest flies, we're supposed to be feeling them in the chest. All right, so the right technique, the right position there would be make sure that both your shoulders are depressed. You can do that by ensuring that the seat's at the right level. Okay, and if they're both lower down, you're going to keep your chest high, retract the shoulder blades, all chest. Okay, I almost like to try to keep your thumbs, don't bring your thumbs up above your nipple line. That's a good rule of thumb to make sure you're not getting that upper trap involvement there. Okay, that's my leading theory for what caused this. And when we do get left scap strains, they can hurt a lot. All right. So overall, very happy to see what we're doing, seeing the result that we had here. Do you have any questions for me for now about how we're going to proceed here, or about what else is necessary?
What was the muscle? The left?
The levator scapulae, or lev scap. So I'm not saying left, I'm saying lev.
Okay.
Right? But lev scap is the short form for it. Levator scapulae, or lifter of the shoulder blade. Okay. That's the actual term for it.
And it's above the shoulder.
I will show it to you, but it connects the top of the shoulder blade up into the C-spine vertebrae there, so directly up into our neck,
would make sense,
which was also where you're saying you're feeling most of your strain originate from, right? Any other questions at all?
Just, I guess, how to maybe manage the next week or two and recovering from it.
So generally, movement is encouraged. Okay. Anytime we injure ourselves, we want to give maybe like a 48-hour rest period. But as soon as you're able to, you want to be moving your structures through the available range of motion. Why? That's because movement promotes healing. Okay. What I did with you is I went ahead and I moved all the structures, and now you feel better. Okay. In the moment, maybe the massage didn't feel great, but afterwards you feel better. Right? It's the same concept with exercise. When you're starting off, when you're doing it, might kind of suck, might kind of hurt. Afterwards, you feel better. Okay, so my general rule of thumb is like, go back to the gym, do the things that you can do. If you're doing a movement and it pushes your pain above a 3 out of 10, so like if you're doing an exercise and that neck pain is a 4 or more, discontinue. Find a way to modify it. Lower the weight, change your posture, decrease the rep count, something along those lines. But generally, the people who get back to activity and the people who continue their training fare better as compared to those who do not with musculoskeletal injury.
Okay. Any stretches or like arm circles good, or any specific
stretches?
Absolutely.
Usually I talk about these off camera, but with you, because it's the left scap's really easy to do. So the left scap, again, if it connects from the shoulder blade up into the neck, we stretch that by doing what's actually we call the armpit sniff. Okay. So with this end, you're going to turn your head away from the side that's being affected. So you're going to turn to the right. Then you're going to flex, you're going to bring the chin down. You can take your hand in this position and almost pull your nose down towards your armpit. It's the armpit sniff, just as if you're checking if you put on deodorant. That's going to stretch out that region there of the left scap. Obviously, you don't want to go too hard. You don't want to actually hurt it more, but the stretch, the pulling should feel good. Then there's also the trap stretch. So for the trap stretch, similar, but all we're going to be doing is bringing our opposite-sided ear down to our shoulder, so tilting away. And again, you can grab your head and pull it further to get an overstretch there. Those are two ways to induce some movement into those regions. Again, I'm not a huge fan of stretching on this channel, but when we are trying to introduce some rehab when we are still in an acute or a subacute flared state, great way to get some movement into the air, great way to start the movement and healing process there. But ultimately, the best thing that I think you can do is get back in the gym. Just again, make sure your form is good on those chest exercises. You can also consider hiring a personal trainer for a few sessions to walk you through a few unfamiliar movements. Okay. Any other thoughts?
No, it's good. Thank you.
Awesome. Well, Eric, great meeting you today. Thank you so much for coming in, and I'm confident that we're going to be able to get you better.
Okay.
All right?
Thanks, man.
Thank you so much.
Thank you. Don't forget to like, comment, share, and subscribe.
Thank you so much, Eric.